so today we have another Director of Clinical Education from one of the Consortium member schools. We have Dr. Lori Hochman, who has joined us from NYIT. And today we're going to be talking about different tips and strategies for providing and receiving feedback. So a lot of communication goes on when students are in the clinical environment, and there are different ways to navigate challenges and also be able to provide strong, effective feedback. So I'm going to let Dr. Hochman kind of take it away here. And the first topic that we're going to be talking about are strategies of how to receive feedback. So I'll let you take it away on that.
Good morning. One of the first things that I think is really important to discuss with your student during that first week is how they like to receive feedback and how you usually give feedback, because it obviously depends on the environment that you're in, whether it be on the fly feedback after each patient, maybe at lunchtime, or maybe it's at the end of the day, depending on how your environment is structured. So I think it's really important to have that conversation up front so they know your expectations about how that will happen. Sometimes feedback needs to be given immediately due to patient safety, and sometimes feedback can wait until a break in the day or at the end of the day. So I think that's a really important conversation to have up front. And remembering that feedback can be given in many formats. It can be given in a written format, even using weekly planning forms, which you probably receive from many schools, or your clinic might have their own form. It could be verbal feedback in that you're providing feedback in the moment, or it could be nonverbal feedback where you develop kind of some type of signal with your student of, time out, let's take a moment, or they might have a signal for you when they need help or they need you to step in. The feedback can also be more conversational in front of a patient, including the patient in the conversation, depending on the setting. And it could be more formal where you're giving it at the end of the day, or you have set time, hopefully set in your schedule, to have that kind of summative conversation toward the end of the week to really reflect on the week. And maybe that's on a Friday, or maybe it's on a Monday to get your week started.
Great, awesome, thanks for that. And now on the flip side, what are some ways that feedback can be given in the clinical environment?
Yeah, I think it's really important for CIs to consider how they're giving feedback and where they're giving feedback, and we'll get into that. There are a couple of techniques that I really suggest to CIs to use. And the first one, and I think everybody knows this one, is the sandwich technique, where you're providing positive feedback, you're providing constructive feedback, and then ending with something positive. But what's really important about that technique is making sure the meat or the sandwich is not lost. So making sure that positive feedback on both ends is actually related to the issue that you're talking about, so that it's not these random facts being put together. So, and then making sure the student understands and reiterates, because sometimes if you end with the positive, that's all they hear. And so making sure they're hearing the meat and really understanding that that's the behavior that needs to change for the next day or the next patient, so on and so forth. The other technique, and I think I tend to like this one better, is really having a back and forth, but having the student really self-reflect on their performance. So the first question to a student, and it's not on every patient, maybe it's a couple of particular patients that you really think it will be important for them to reflect on, is asking them, well, how did you think that went? How did that session go? How did that conversation go? Whatever that patient interaction is, and asking them how they think it went. And you might not even be looking for them to find something negative. You just want them to reflect on also the good things that they've done. So you have them reflect, you listen, and then the CI can reflect back and say, yes, I agree with you. In addition, I think these things went well. In addition to what you said, because students often actually give their positive and they go right to the negative instead of staying on the positive thing that they've done in that session. And so the CI can reflect. And then the second question following up is, what can be improved? Asking them, that session was really good. What would you do differently next time? What would you improve if you're going to see that patient again, or a similar patient in a similar situation again? And then listening, and then reflecting as a CI and saying, yes, I agree with you. In addition, you could have done this, this, and this. I think that would have been helpful, right? So those are the kind of two take-home techniques that I think are really helpful. Sometimes with the self-reflection, I tell CIs to kind of wait until around midterm. Sometimes students aren't quite ready to self-reflect week 1 or week 2, but at midterm, it's a really nice turning point to say, hey, I'm going to step away as a CI and probably not be providing as much feedback, but I'm going to be asking you to self-reflect. So I really want you to think about each session, and almost having the student initiate that is also a really nice way to have them take more ownership of their learning.
Great. I think that's all really useful information. And then I think you had a couple other just kind of bullets and kind of nuggets of wisdom regarding feedback and being able to provide it in the most efficient and best way.
Yeah, there's definitely a couple of things to keep in mind as you're providing feedback. I think number one is making sure it's really specific and not this general feedback that the student doesn't really know what you're getting at. So really give them a specific time, patient interaction where they can remember it. And that kind of leads into it needing to be timely. So if a patient student has an interaction or a session on Monday, the feedback should be on that day, not on Friday, right? Especially if that feedback is constructive and you're looking for a change in behavior, because they might not remember what happened on Monday. So really making it timely as possible, whether it be after the session, when you have a break, or at the end of the day. In addition, try and keep it positive, but obviously if you're giving constructive feedback, there's going to be some feedback in there that might be difficult for them to take. So maybe using that sandwich technique in that as well. Also making sure if it is sensitive feedback that it's provided in a private place, not in the open clinic, and not in front of a patient unless it's a safety issue in that moment. The information you also give in terms of constructive feedback should be firsthand information, not information that you've heard from a therapist or somebody reported to you, that it really should be something you observed as their clinical instructor. In addition, really making sure that the feedback is objective, that it's based on a behavior, based on their performance, and not necessarily based on a personality trait, right? We don't have to like everybody, and you might, from a CI point of view, not love your student and not align with them from a friendship point of view, but making sure that the feedback is focused on their actual performance and objective details from a session. And then lastly, kind of bringing it all home is checking with the student for clarity. So if you have one of these conversations where you're really giving feedback, you really want to make sure they're taking it in, check for understanding. And we do this with our patients too, having them kind of teach back or repeat back what the conversation is. So what are you going to do differently tomorrow, right? And what are you going to do to prepare tonight to be more effective tomorrow? So those are ways of checking of how are they processing that information? Are they hearing me in the way that is coming out? And then you can always clarify for details if their perception or their interpretation is different from how you delivered that information.
Great, great. So hopefully you've gained some tips on how to give and receive feedback from this video. Be sure to check out some of our other videos for more helpful tips in clinical education. I want to thank Dr. Hochman for spending the time with us today.